Videographers, hope you are doing good. Welcome to a new tutorial video, and it's about MR difficogram or proctogram, and it's a theoretical lecture video. MR difficogram is an interesting procedure and it's getting popular day by day. So let's start. So let's start with the introduction. What is MR difficogram? MR difficogram, also known as defecating proctography, and it's an imaging technique mainly assessed to assess the structure and function of the pelvic floor during defecation. So defecation is the process of evacuating stool from the rectum through anus, and it helps diagnose certain conditions like chronic constipation, fecal incontinence, rectal prolapse, and pelvic floor dysfunction. These are the common, and these are associated with the pelvic organs and muscles during the bowel movement and the defecation process. So let's discuss about the pelvic floor structure. So in this diagram, this is the rectal canal and this is the vaginal canal. So around the rectal canal, there are few muscles that are involved in the process of defecation, and the main muscles are the pubococcygeus muscle that is in front and start from the pubic crest, and at the back is the iliococcygeus muscle, and these two muscles together called the levator ani. And there are also some major muscles like iliacus muscles that is not directly involved with the rectum. In this diagram, you can see the sphincter of the anal canal. So these sphincters are worked during the defecation process. So this is the rectum and this is the anal canal, and this is the anus. And both sides of the anus, there is two major sphincter. The one is the internal anal sphincter. So this is the internal anal sphincter, and these are the external anal sphincter. And sphincters are actually muscles, modified muscles, and this external anal sphincter is at the end of the puborectalis muscle. And now the indications of the MR difficogram. There are lots of reasons to advise MR difficogram. The first one is that the descending perineum syndrome. And what is this descending perineum syndrome? Descending perineum syndrome refers to a condition where the perineum balloons several centimeters below the bony outlet of the pelvis during strain, although this descent may happen without straining. And then the internal rectal intersusception, and this is a condition where the rectal wall folds inward upon itself during a bowel movement without necessarily protruding outside the body. That means the rectal is folds inside the rectum. So rectal folds inside the wall of the rectum, and difficulty in opening bowel, and then obstructed defecation, and then fecal incontinence. So fecal incontinence is the term when the lack of control over the defecation leading to involuntary loss of bowel contents, including flatus, liquid stool elements, and mucus or solid feces. And then pelvic floor dysfunction and rectal prolapse. So rectal prolapse occurs when walls of the rectum have collapsed to such a degree that they protrude out of the anus and are visible outside the body. And then sigmoid cell. The sigmoid cell, also known as pouch of Douglas descent, is a medical condition in which a herniation of peritoneum containing loops of redundant sigmoid colon descends into the recto-uterine pouch in females between the rectum and the vagina. And then the rectocele. So rectocele is a term. Posterior vaginal wall prolapse results when the rectum bulges into the vagina. And two common causes of the defects are childbirth and hysterectomy. And then the enterocele. So enterocele is a herniation of the peritoneum lean sac containing small intestine through the pelvic floor between the rectum and the vagina. And enterocele is significantly more common in females, especially after hysterectomy. And the anismus. The anismus or dysphalangic defecation is the failure of normal relaxation of pelvic floor muscles during attempted defecation. So these are the main reasons or indications for MR defecogram. And now the contraindications. So contraindications are more common in MRI, that any electrical, magnetical, and mechanically activated implant like cardiac pacemaker, insulin pump, and cochlear implant. So having these devices of the patient, this patient is contraindicated. And then intracranial aneurysm clips is contraindicated. And then pregnancy. And for pregnancy, risk versus benefit ratio to be assessed. And then ferromagnetic surgical clips and staples. And metallic foreign body in the eye. And metal sharpnel or bullet. And patient preparation for MR defecogram. It is important that the bowel is clean and empty before the procedure, and patient should be supplied with a laxative suppository and instruction leaflet for how to insert the suppository. And patient should be asked to insert it into the rectum in the morning during the test, and the patient should retain the suppository 15 minutes and then empty the bowel completely. And if you can give enema to the patient, it will be best option if you have the facility to provide enema to the rectum. And the materials needed for this procedure is an adult diaper, ultrasound gel, and Tommy syringe, then Jesocon gel for lubrication, and the hand gloves. So instead of Tommy syringe, you can also use catheter, Foley's catheter to insert into the rectum, and also you can insert the Foley's Tommy syringe directly to the anus. And now the patient positioning for MR defecogram. Patient positioning is head first supine, and place the body coil over the pelvic region and make sure that the lower part of the coil include the anus and the rectum. And patient should be wear a diaper before the positioning. And now the protocols. The first protocol is a localizer. A localizer gives you three images: coronal and axial and sagittal, three initial images for planning. And then the next protocol is the T2 sagittal, and that is 3 mm pre-proctogram. And this is a 3 millimeter slice planned over the axial and coronal image, and the mid slice should go over the mid rectum, and the field of view should be small, like 200 to 250 millimeter. And then a coronal oblique 3 millimeter pre-proctogram. So the slice on the sagittal image slices should be parallel to the anus, and also on the axial image the slices should be perpendicular to the anal canal, and the field of view should be small, and 250 is preferable. And then the axial oblique slice, and it's also 3 millimeter pre-proctogram, and this plan is given over the sagittal and coronal image, and on the sagittal image the slices are perpendicular to the anus, and in coronal image the slices are perpendicular to the anal canal. And if you look at the coronal image, that this coronal image should cover the anal canal, rectum, anal canal, and anus. And this is the prostate, as this is a male patient. And now pause for proctogram, and then guide the patient to lie down in either a right or left lateral position, and the technologist will insert Tommy syringe that is lubricated, and ultrasound gel will be inserted, and the amount of the gel will be 150 to 200 milliliter, and then remove the syringe and place the patient back. Actually, then place the diaper to the patient, and then position again, and instruct the patient to clench, relax, and strain during the image capture. So during defecation, there are some process like clenching, relaxing, and straining. So I will discuss. And then again take localizer as the patient moves during inserting the gel. So localizer should be again repeated, and coronal, axial, and sagittal image will appear. And now after the pre-proctogram, and then again we will take the same protocols, and that is after the inserting the gel, and that is sagittal 3 millimeter, T2 sagittal 3 millimeter, and T2 coronal 3 millimeter, and then T2 oblique 3 millimeter. So these protocols are after inserting the gel. And now is T2 true fit cine small, field of view 10 millimeter, and this is a protocol, cine protocol. That means cine means the video protocol, and this protocol will be planned just midline of the rectum and anus, and it's a sagittal protocol. So plan on the coronal and axial image, just midline of the rectum, and the image will appear like this in the sagittal image. After this planning, now take the cine resting face protocol. So you can see that this is a video playing, and in this position the patient is doing nothing, just lie down, and urine is entering to the bladder. That's why you can see that. And this patient lies in the MRI scanner in supine position and relaxes, allowing for baseline measurements of pelvic organ position. And this is cine squeeze phase after the resting phase. Now you tell the patient to contract the anal sphincter muscles and pelvic floor muscles. So tell the patient to squeeze his pelvic floor muscles and mimicking a pelvic floor muscles contraction. This phase helps assess muscle strength and coordination. So if I play the video, you can see that the patient is contracting his muscles, and muscles goes up and down. So this is the process of the squeezing. And next, the strain phase. And in this strain phase, patient performs a Valsalva maneuver which involves bearing down as if having a bowel movement while keeping the anal sphincter closed. So this stimulates the straining phase of defecation. If I play the video, you can see that patient is trying to evacuate the gel, but he shouldn't evacuate the gel, but he will try to bear down the gel. And next is the senior defecation phase. So in this phase, patient will relax his anal sphincter and pelvic floor muscles and simulate the act of defecation, expelling the contrast material from the rectum. So in this phase, the patient will evacuate the gels from the rectum, and during the defecation process, he will evacuate all the gels. He will try to evacuate the gels. So let's play the video of the senior defecation. You can see that the gels are coming out from the anus. You can see that the gels have come out from the anus, and this is the defecation process and how we evacuate. So if I play again, you can see that this is the process, and there is an abnormal case that the rectum is pushing the vaginal wall. You can see that this is the defecation process again. So let's see again from step by step from the resting phase. So this is the resting phase. So let's see the video. You can see that this patient is doing nothing, but the bladder is filled with urine, and urine is coming to the urinary bladder. That's why you can see like this, that urine is moving inside the bladder, but the rectum is in resting phase. If you see again, let's see the now squeeze phase. So in this squeeze phase, patients contracted his pelvic floor muscles. You can see that the pelvic muscle, the levator ani, is up down. And now the strain phase. So in this phase, patient will try to expel the gel, but he didn't. And now the defecation phase. In this phase, patient will defecate and expels all the gels from the rectum. And the rectum, there is a rectocele, anterior rectocele, because the rectum is pulling his vaginal wall. Again, you can see that the rectum is going anterior and pushing to the vaginal wall. So this is a anterior rectocele case. So let's go to the next slide. And if you see all the stages together, rest phase, squeeze phase, strain phase, and defecation phase. The complications of MR diffugram, there are some complications after the procedure and during the procedure. The first one is the discomfort. So patient may feel discomfort when inserting the contrast gel, and the gel may be inserted to the also the vagina and the rectum, of course. And for during the positioning, patient may feel discomfort because patient have to position laterally and uh, put put off his diaper and show the anus. So it is a discomfort phase. And there is complications during incomplete study because the patient may be unable to evacuate the gel, and uh, this is complications during because of the patient's problem, or because of the patient's inability to defecate. And patient may feel anxious or embarrassed during the procedure, and you have to reassure the patient. And there is complications, contrast related issues like allergic reactions, and that is very rare because uh, in MRI diffusiogram, no gadolinium contrast is used. And then rectal irritation or minor bleeding, so it can happen because to the anus, Tommy syringe, all the catheters are inserted, and if it's not inserted properly, then it will make bleeding to the anus or rectum, and patient may feel bloating and cramping from air because air can insert into the rectum during the during the inserting process of the contrast, and with the gel air goes to the rectum, and for this air patient may feel bloating and cramping of the abdomen. And also there is complication during the MRI procedure because of the claustrophobia. So patient may be claustrophobic, and it's a condition where patients feel afraid to insert into the MRI gantry. And in this situation, you have to reassure the patient and consult with the patient. And then metal implants. If the patient have any metal implants, then the patient is contraindicated. And during the MRI scan, there is noise, and it takes time to complete the scan. So patient may feel afraid during the procedure. So these are the common complications of MR diffusiogram. And now lines of the pelvic floor. So there are 3 lines of the pelvic floor that radiologists actually use to diagnose the pathologies. And these lines are pubococcygeal line. The main line is the pubococcygeal line, and then the H line and the M line. So the pubococcygeal lines, so you have to draw lines during the procedure for the radiologist. So pubococcygeal lines is from the base of the symphysis pubis to the sacrococcygeal joint. And this is the PCL line, and it's called the pubococcygeal line. And then the H line goes the base of the symphysis pubis to the anorectal junction. This is the H line, and from the anorectal junction to the PCL line, there is a line drawn, and this is M line. So these are the lines, reference lines used for the baseline as to detect any abnormalities of the pelvic floor muscles and organs. So now let's see some abnormal cases. The first case is spastic perineum syndrome. So what is this spastic perineum syndrome? I played the video. Spastic perineum syndrome, also known as spastic pelvic floor syndrome, is a condition where the pivorectalis muscle, part of the pelvic floor, contracts inappropriately during defecation and hindering the normal relaxation and widening of the anorectal angle. So this is the spastic perineum syndrome you can see. And now is the case of rectal prolapse. This is the second case. You can see that in resting phase, so the left image is the resting phase and the lines are drawn, PCL line, S line and M line. But in the defecation process, you can see that the M line is increased and it's a rectal prolapse because the rectum goes down to the anus. And now let's see the video of the rectal prolapse. So this is the rectal prolapse video. You can see that during defecation, rectal prolapse occurs when walls of the rectum have prolapsed to such a degree that they protrude out of the anus and are visible outside the body. So rectal prolapse protrude out of the anus and it can be visible. So if I play again, I played again the rectal prolapse, you can see the rectals goes down to the anal canal, to the anus. So this is the rectal prolapse, and sometimes rectum goes out of the anus. Now the third case is the rectocele. So rectocele is a case in the left side image. You can see there is a blue line, and this is a anterior wall, anterior line. And during defecation, the rectum crosses the line and push the vaginal wall. So this is a case of rectocele. So a rectocele is a case. So let's see a rectocele video. So this is the rectocele video I have played. So rectocele or posterior vaginal wall prolapse results when the rectum bulges into the vagina. The two common causes of these defects are childbirth and hysterectomy. Rectocele also tends to occur the other forms of pelvic organ prolapse such as enterocele and sigmoidocele and cystocele. So go to next case, and this is a uterine prolapse with cystocele and rectal prolapse. And you can also see the reference lines of the pelvic floor at rest and defecation process. And at the defecation process, you can see that uterine prolapse, that means the uterus goes down. Uterus goes down the reference line or PCL lines, and also the cystocele, that means the bladder prolapsed, and the rectum also prolapsed. So all the organs are prolapsed down. So let's see this video of this uterine prolapse with cystocele and rectal prolapse. You can see that the bladder, uterus, and rectum all are prolapsed down. So this is a case of the uterine prolapse with cystocele. So cystocele means the bladder prolapse down with the rectal and the uterus. So this is a good case of defecogram. So thanks for watching. Hope you enjoyed this video. So if you like this video, please hit the like button and don't forget to subscribe my YouTube channel, and of course hit the bell icon to get notification of my latest videos. Thank you.